Today we're talking about one of the oldest healing traditions, the practice of utilizing plants to support health and restore balance in your horse's body. Do you want your horse to be strong, healthy, vibrant, and resilient? Do you want to proactively prevent illness and injury and have your horse recover with ease when challenges do arise? Welcome to Hale and Hardy Horses, your trusted hub for equine wellness and holistic care. Hi, I'm Dr. Rebecca, and I'm your host. This week we're talking about herbal medicine, or the process of using leaves, roots, flowers, and seeds of plants to restore balance and vitality. In horses, herbs can address both acute conditions and long-term wellness, with many herbs providing nutrients, antioxidants, and bioactive compounds that help do things like reduce inflammation, support digestion, strengthen the immune system, calm the nervous system, or even aid in tissue repair. In our modern world, most horses eat hay, grain, and pasture that's far less diverse than what they need or what their ancestors had access to. That can leave gaps in nutrition and in their resilience. Herbs can actually help fill those gaps and bring horses closer to their natural way of thriving, while also being an effective way to deal with illness and injury. Like we talked about in the first podcast, equine herbal medicine emphasizes treating the whole horse rather than just the symptoms, and actually can be used for a variety of conditions. A few examples include things like soothing anxiety, supporting the digestive system function, treating ulcers, detoxing or supporting liver function, addressing underlying causes of many illnesses and disease, supporting the immune system, and of course, addressing musculoskeletal discomfort and pain. So before we unpack this subject further, I want to actually tell you a story about my own use with herbs and my own horses. About 5 years ago, what I call my big horse and I traveled about an hour and a half away for a clinic. And since the travel was pretty far and the traffic is usually horrible going in that direction, I decided to actually get stabling for the clinic. Little did I know that once I got there, the stabling was set up so that every horse that passed by could actually come into nose-to-nose contact with my horse. I would have never done this if I had known that that was going to be the setup, and I was actually really upset. But once I got there, I kind of didn't have a choice. I could have packed up and come home. That would have been my only choice. Sure enough, about 5 days after the clinic, my horse came down with a horrible respiratory infection. The vet came out, they ran tests, and actually decided that yes, he should be put on antibiotics. And that seemed to work for a little bit, at least for a little while, but once he came off the antibiotics, the infection actually came back worse than it was originally. So of course the next step was harsher meds, but that unfortunately too didn't completely clear the infection up. So then we started looking at doing things like flushing the guttural pouches, and we actually got a sample and sent that off for testing so we could really get an idea of what we were working with and how to target the specific organism. The results of that came back quite suspicious, so then the next step was actually to make an appointment and have a full workup done at the veterinary hospital. By that time, this had been weeks that my horse had been sick, so I had decided to start him on some supportive herbs to help do things like clear phlegm, help him with his cough, boost his immune system, and just give him general support. It really wasn't any sort of antibacterial or antifungal or antivirals that I used. I was literally just trying to support his system so that he could fight the infection off himself. I literally was looking at anything that would help him get over this horrible infection. So I came up with this herbal formula and I started him on it. Sure enough, by the time we had our hospital visit, he was very much on the mend and almost normal. I kept the appointment anyway because I was really concerned about these relapses that he had had. And so we took him to the hospital, they checked everything out, and he actually got a really good report. Sadly, I ran into a friend of mine that was also at that same clinic, and her horse got the same respiratory infection and had the same difficulty getting over it as my horse did. So it was kind of, I felt like, a superbug. So in the long list of treatments that my horse had, what did the herbs actually do? So these herbs actually help support the whole horse, not just treat the symptoms. And they gave him the needed boost to finally kick the infection to the curb. So I wanted to give that an example because that is the power of herbal medicine. And that's a really good way to use it in combination and complementary to what you're already doing with your veterinary care. So I want to talk about 3 major systems of herbal medicine that you will see both personally in your own life, but also in your horse's life and even on supplement shelves. The first one is Western herbal medicine. So Western herbal medicine has its origins in the Greek, Roman, and European folk traditions. And then, of course, later was influenced by modern phytotherapy. So studying plants and the chemical constituents that they have and how they can help with disease and illness. So it really focuses on plant chemistry and physiology. Often you're using herbs to address specific symptoms or specific body systems. For instance, chamomile can be relaxing. It is good for digestion, or milk thistle is very protective for the liver. Of course, this is a more reductionist view because you're actually identifying active compounds and you're matching the herbs to conditions. But it also values traditional knowledge that was passed down over the years. And of course, with that comes that more holistic view of the body. So common herbs that you've probably heard of in this category would be things like peppermint, nettle, chamomile, echinacea, valerian. The second system that I want to talk about is actually Ayurvedic medicine. So this is Indian medicine. Its origins are over 3,000 years old. And the philosophy is that Ayurvedic medicine actually views health as a balance between the 3 doshas, which represent different elemental forces in the body. And any illness is seen as an imbalance of those elemental forces. Of course, the herbs are chosen not only for the physical effects, but also how they influence energy, digestion, and mind-body harmony. Common herbs that you would hear in this category are things like ashwagandha, which is an adaptogen, and turmeric, which is an anti-inflammatory. The other system that is very prominent in herbal medicine is traditional Chinese medicine. The origins of that are over 2,000 years old and rooted in the Taoist philosophy that health depends on the flow of life energy. The approach here is that herbs are often combined in formulas designated to restore balance in the whole system. And any sort of diagnosis is based on patterns, not symptoms. We'll talk about that more in a future podcast when we really get more into Chinese medicine. But common herbs that you've probably heard of in this category include ginseng, which is an energy tonic, licorice root, which is a harmonizing herb in many of the formulas, and astragalus, which is great for immune support. For horse people, most of you are probably used to Western herbal medicine, but actually the elements of Ayurvedic and Chinese medicine are increasingly found in equine care, especially the adaptogens and especially these basic balancing formulas of Chinese medicine. So now I want to give some guidelines for best practices. So if we're looking at the general overall arching principles of herbal medicine and we want to use them with our horses, we need to know some basics. So number 1 is whenever you're using herbal medicine, you want to start with a solid foundation of care. What do I mean by that? So, herbal medicine works best when the basic needs of the horse are met. So, that means nutrition, dental care, proper management, good farrier work, and a great veterinary care. So, when all those needs are met, herbal medicine is the most helpful. The other thing under this is that the herbs should complement your good horsemanship and veterinary care. Just like in the example I shared at the beginning of the podcast with my own horse, that it was the combination that actually brought about the best scenario for my horse, given the severity of what was going on with him. The second best practice I want to talk about is actually working with quality herbs. So you want to choose herbs from trusted suppliers that are tested, that you're definitely getting what you ordered, that they are pure and there's no contaminants. So common contaminants in herbal formulas or herbal products would be pesticides, heavy metals, herbicides, and mold. I always recommend to buy organic herbs when possible because that helps cut down on some of those contaminants. And of course, there's a lot of herbs that can be wild crafted, which means they grow in the wild and you can harvest them from the wild. It's a little bit of a touchy subject though, because some of these herbs are found in the wild in plentiful sources, and it's ecologically okay to harvest a small portion of them. You don't ever want to go in, even if an herb is prolific across the country, you don't want to go in and take all of the herb out of a particular area because you're basically eliminating that. And some of those bad practices is what's got us in trouble with wildcrafting. Because there are many herbs that are becoming scarce because people are collecting them and they're not doing it in an environmental friendly way. And so instead, I encourage people to find herbs that are grown with environmentally friendly practices. So don't go out into the woods and harvest them. Let things stay wild. Let things that are naturally there be there, but find herbs that are organic or that are environmentally consciously grown. And of course, you want to avoid any products that don't actually list the exact ingredients. The third best practice is to introduce the herbs gradually. Horses have very sensitive digestive systems, so I encourage people to start with small amounts and build slowly. While this podcast is beyond what herbs are best prepared and what methods, know that following the directions of the herbalist will give the best results. But most of the time, you'll be infusing the herbs in warm water. You'll be letting them soak to bring out their medicinal qualities. Then it makes it easy to mix those herbs into damp feed or soaked hay pellets. And that makes it much more palatable for your horse while also guaranteeing the medicinal properties. I recommend not putting dry herbs or powders in the feed because of the possibility of inhalation and respiratory irritation. So number 4 of the best practices is actually to match the herb to the horse. This seems common sense, but you want to look at the horse's age, their workload, their temperament, their diet, their health history, and the symptoms or pattern that they're presenting before you pick the herbs. Always use herbs with a specific goal in mind. Are you looking at calming? Are you supporting joints? Are you aiding digestion? And avoid this one-size-fits-all approach. I often see that if one horse does good on an herbal supplement or an herbal formula, that it gets recommended, and then a lot of people seek out that one particular herb or herbal product or herbal formula. And that's the sort of one-size-fits-all approach. And what I encourage you to do is actually to get a formula that's individually made for your horse. The other problem in this category is avoid mixing many herbal supplements together without the oversight of your herbal practitioner. So they'll be able to tell you if there'd be bad interactions, or maybe you've got 2 herbs doing the same thing and it's redundancy, or maybe it's just too much and the horse's body's going to get confused, or it's going to be too much for the horse's digestive system to filter, or it's going to be too hard on the liver and kidneys. The 5th best practice is actually to respect the dosage and duration. So more is not always better. Overdosing can stress the liver or kidneys. And while herbal medicine is usually safer than prescription medications, herbs are not without cautions. I encourage you to stick to established dosage ranges based on your horse's weight. This can be a little confusing when we talk about standardized product versus whole herbs, and we will actually cover that in depth at a later date in a different podcast. And then the other thing in this category is actually to use herbs in cycles. So I always tell people that 6 to 8 weeks on max. So that's, 1 to 2 months basically. And then you're going to want to reassess. I never tell people to keep your horse on a herbal formula long term or indefinitely. Now, there is some herbs that are very safe for that, but I still recommend that people take a break personally themselves and with their horses about every 2 months to give their horse like 2 weeks without the herbal formula, even if they feel that they need to repeat it. The sixth guideline is to watch for interactions and contraindications. Herbs can interact with each other. They can also interact with prescription drugs. So you really want to either have that knowledge yourself, be able to look that knowledge up, or consult an herbal practitioner that can help you figure out the specifics for your horse and the medications and herbs that they're already on. You're going to want to avoid certain herbs in pregnant mares and in lactating mares because of the chemical properties that could be passed to the fetus or to the foal. And of course, you're going to want to be careful in metabolic horses, in aged horses, or those who have a compromised immune system. You're always going to want to check for safety about combining herbs or when you're using alongside medications. The seventh best practice is actually to observe, record, and adjust. So what do I mean by that? I mean monitor changes in the appetite, the energy, the behavior, the coat quality, the manure, and the symptom changes of your horse when they're on an herbal formula. You're going to want to keep a journal noting the date that you started the herb, what actual herb the horse is on, the dosage, and then of course any daily observation and any response that the horse has. If you see anything, any sort of adverse effect, you're going to want to stop immediately. That means diarrhea, digestive upset, colic signs, lethargy, any sort of swellings, or any reaction that you think would be related to the herbal product. It may not be, but it's always safe to then clear whatever that is and then restart the herbal formula. The eighth best practice is to collaborate with professionals. So that means that you're going to want to have your vet involved in this. You're going to want to work with an herbal practitioner because herbs are not without risk. There's potency, dosage, and interactions that can cause side effects if they're not used properly. For this reason, successful use of herbal medicine for horses requires careful consideration. Ideally, you should work with someone very knowledgeable in herbal medicine. And while it's convenient to pick up an herbal supplement in the tack store to address your horse's problems, it's not without precaution. Have someone look at your horse's constitution, look at your horse's health status, their diet, supplements, medications, and then respect their knowledge for recommendations on how you should use that product or what herbal support you should be supplying to your horse. The ninth and final best practices is to think about the long-term balance of your horse. So herbs aren't quick fixes. We're not going for the short-term symptom control. We have to realize that the power in herbal medicine comes from supporting gradual healing and balance. Just like in my example with my horse, it was the icing on the cake that helped him get rid of the respiratory infection. It helped support his system so that he could fight it off himself. The success of herbal medicine is usually accompanied by good management practices and good veterinary care. So I see a lot of people who might forgo veterinary care and do herbal medicine. While I love herbs and I think they have a great healing potential, I don't want people to just forgo diagnostics or forgo having their veterinary look at their horse to have a good feel for what the horse needs and what would be the best way to support the horse and what the problem is. So now I want to talk about some common pitfalls. So we talked about, hey, this is what you should do. This is the best practices. Now I want to talk about, hey, what you shouldn't do or what some common pitfalls are that people fall into when they use herbal medicine. So the first one is that a lot of times people think that natural means that they're risk-free. Well, they're not risk-free. They are most of the time lower risk, although there are some very potent herbs out there that have high risks. But we talked about before that this risk-free isn't true. That just because an herb grows in nature doesn't mean it's harmless. Some plants are toxic to horses, as are some of the medicinal herbs. There's herbs that we use in human medicine that we cannot use in horses. And of course, even safe herbs can be harmful if they're used in high doses or if they're used improperly. We talked about this before when we talked about our best practices, but a common pitfall is to avoid those poor quality or contaminated herbs. So you don't want to get low-grade products that contain fillers, pesticides, molds, heavy metals. And if you're using herbs that grow on your land, you want to make sure that the identification is correct and that the plants have not been exposed to any sort of chemical. And sometimes you got to be really careful when you're buying a product to make sure that there's transparency in the labeling so you know exactly what you're getting and exactly what you're feeding. The third pitfall is guessing at dosage. Now, this becomes a little bit hard because where the herb is grown, the environment, the sun, how much water it got can all affect the chemical constituents that actually make the herb a medicine. However, there can be large ranges in dosing, and we have to be careful with that because horses metabolize herbs differently from humans or even from other animals. And eyeballing amounts or copying human doses can lead to either overdosing or underdosing. So always follow the herbalist guidelines or the manufacturer's recommendation when you're using a herbal product. The fourth pitfall would be ignoring interactions with medications. So some herbs actually amplify a prescription medication, and some herbs actually reduce the effect of a veterinary drug. So this overlapping effect can happen, like combining an anti-inflammatory drug with an anti-inflammatory herb, and those things can amplify the effect. They can also put strain on the digestive system, on the liver, on the kidneys, and even the immune system. The fifth pitfall is actually using herbs instead of veterinary care. So we talked about this before, that herbs can support healing, but they're not going to be able to replace diagnostics. As we talked in the very first podcast, emergencies and things like that are best treated with Western medicine. You don't want to delay necessary veterinary intervention if it's appropriate at the time. The sixth pitfall I want to talk about is mixing too many herbs at once. So complex blends of herbs make it hard to actually know what's working or what's causing a side effect. And actually, I have found that horses respond better when you keep the formula simple. Another caution is actually about not combining herbal systems. So I see this a lot. I'll walk into a barn and an owner will ask me to look at the supplements or to look at the herbs that their horse is on and give them some feedback. And I'll see where a horse is on 3 different products. And each of those products has like 10 herbs. That's 30 herbs that the horse is getting. And most of the time, those 30 herbs have not been studied in combination. The formulas that you see in Chinese medicine are actually specific formulas that have been time tested to be useful, to be effective, and to be safe. When you start combining formula after formula after formula without the help of an herbalist that's overseeing all of that, you're potentially leading your horse into a dangerous situation. You could be harming them, you could be causing toxic effects, and at the very least, you're actually overtaxing the system, or you're confusing the horse's system as to what it's supposed to do. The seventh pitfall is actually not matching the herb to the horse. So all of this we talk about holistic medicine, which is a very individualized medicine where the herbs are actually made for one particular horse. And a herb that helps one horse may be useless for another horse, or worse yet, might even be harmful. It all depends on the disease process that the horse has, on their age, on their temperament, on their health status, and their constitution. All of that matters. I've seen in barns where one horse does well on a herbal formula, and so then the whole barn goes on that formula. And that is not how the system is supposed to work. Now, some of these formulas can be very safe, and it wouldn't necessarily do any harm, but it also would not do any good, and it's just a waste of money, a waste of resources, and it's actually not benefiting your horse. We see this in the horse world a lot, where there's these sort of fads that go around, and be careful when using herbal medicine that way. The next pitfall is actually failing to monitor response. So you've got to keep track of what's going on. So without observation and record keeping, it would be easy to miss subtle signs, subtle benefits, or even early signs of trouble. You want to look at changes in the manure, changes in appetite, or changes in energy, and you want to note them and write them down. And of course, all changes in symptoms, good or bad, should be reported to the herbal practitioner in your follow-up. The ninth pitfall is actually long-term use without reassessment. So we kind of covered this a little bit, but some herbs like adaptogens or liver tonics can be used long-term, but they should be cycled rather than consistently used indefinitely. That means you'll use them for a period of time, and then you'll give the horse a break from them, and then you'll start them back up again. Continuous use can stress the body instead of supporting it, and can actually more likely cause side effects or negative reactions. Or it can actually have where the body stops responding to the herbal treatment, and that you need to give the body a break and then reintroduce it again. So I hope that's a good foundation for you to understand a little bit more about herbal medicine, how it works, how you can use it, the best practices, and the common pitfalls. In future episodes, we'll delve deeper into foundations of herbal medicine. We will look at trusted texts and materia medicas, and how to find quality training or mentors if you want to learn the system yourself. There's a lot of information out there. Some of it's really good, some of it's not very good. So I caution you to make sure that the information that you get is from a reliable source. In the future, we'll also look at individual plant anatomy, actions, and energetics, or basically what the herb does in the body. And we will also cover how to start with some simple formulas for real-world applications. So whether you're a horse owner, a trainer, or simply someone who loves learning about holistic care, I invite you to join me each episode. Together, we'll discuss how holistic medicine can help keep your horse strong, balanced, and vibrant.